The brain is the least understood organ, and yet is the very important organ because it literally runs our lives. Welcome to Mind Vault Podcast, where we unlock minds one story at a time. I'm your host, Dr. Clementine Chawane, and I'm looking forward to having thought-provoking conversations that will help you and your loved ones with regards to mental wellness and building resilience. Hi guys, and welcome to Mind Vault Podcast, where we continue to unlock minds one story at a time. And before we proceed with our show today, I just want to say thank you to our viewers, and would like to also take time to ask you to subscribe. We can see that the viewership is increasing, but the subscription is not necessarily increasing. So if you want to support this initiative, please subscribe and share with your loved ones as well. Thank you so much. So today we are continuing our conversation on introducing you guys to various mental health care providers, but also today we'll be focusing on the mental health facilities. Just in case somebody needs to receive inpatient practice, I want you to know what to expect and where to go. So today I'm having Dr. Lerato Motshudi. All right. And so she's a medical director in one of the private hospitals. And because we are not a marketing show, I will not necessarily mention the hospital group. Okay. But she's responsible for the clinical excellence and the governance across the clinics that she is heading. Her role involves collaborating with doctors, therapists, and nursing team across various across various clinics to improve the quality of care provided to mental health care patients. She has a degree in psychology as well as a degree in medicine, and she has experience in both the public and private sector prior to leaving the clinical practice and joining healthcare management. She has completed an MBA and a certification in compassion. I think I need that certification. She is passionate about healthcare education, finding ways to simplify access to holistic health and well-being services. So she's a right fit for our show because she is she's passionate about the same thing that we are as well passionate about. Dr. Lerato, thank you so much for coming to Mind Vault Podcast.
Thank you so much. Thanks for having me in. Hello, everyone.
So before we start, can you tell us a bit about yourself? I know you said I'm Lerato, and I know that we as medical doctors just love being called by our first names, but how did you become the medical doctor, and how did you get involved in health management? Because most doctors end up in clinical practice, but you took it up the notch. So,
wow. Funny enough, I wanted to become a psychiatrist growing up. I was inspired by The Bold and the Beautiful.
Are you serious?
I used to love Taylor in The Bold and the Beautiful.
God.
And I used to want to become like Taylor. And first time around, I didn't get into medicine. So I decided, I want to do psychology anyway.
Okay.
Studied psychology. Instead of transferring into medicine, I started loving psychology. I was loving psychology so much, I ended up teaching in my third year. But there was still this knowing at the back of my mind, I still want to explore this. So I applied into medicine. I got in the next time around, and then I studied medicine. When I got to my fourth year, psychiatry rotation, and I thought, no, this is not me. I love talking more than listening. That's definitely not me.
Yeah.
So, and then I qualified, navigated the clinical space. And after some time, I became a bit more curious about treating or solving more system-related problems. I look at a healthcare problem or a healthcare system as the patient.
Yeah.
And I think as in medicine, we are trained to find solutions. Mm-hmm. People present you with a problem, you unravel what is being presented to you, and you categorize what you are hearing, and a culmination of all of those things gives you a diagnosis. So I don't see healthcare management as being any different from clinical care.
Yeah.
It's really just looking at the healthcare system as the patient, what symptoms are you seeing? What signs are you able to elicit in the system? And how do you solve for the system's problems? And so I'm a doctor in a different sense.
Wow. Yeah. Okay, that is so beautiful. And I just love your Taylor story, because that is my personal story, hey? That is my personal story, to see that, the patient developed way before you even knew what psychology and psychiatry was. That is so beautiful. And now we report, or we depended on you, because you manage the system that, especially as a psychiatrist, sometimes need, because sometimes we get our patients who are very sick and needing inpatient care. So in my practice, especially in public, in private practice, but in my independent practice, not in the hospital setting, I get to see patients. I hardly refer patients for admission, because the patients who are regular with seeing their psychiatrist and their psychologist are less likely to have a relapse needing admission. And so what I have seen is that most of the patients get referred by either a psychologist because they're in a crisis, or they're referred by a general practitioner because they feel like the patient is at risk of self-harm or even hurting other people. And so one of my ice-breaking question is, how did you feel when your doctor said you must come into hospital? And most patients tell me, I was scared. I was scared to come in, and because I just thought that I'm going to see people in straight jackets. There was a young boy who said he actually stayed up all night Googling on how to defend himself in case a mentally ill patient attacked him. And I'm like, wow, I don't know where you get this. And most of the time when I ask them, but who told you about straight jackets and that, is that they would say that they saw it in the movies. And so they believe that mental health care services are like that. And so the reason for the interview today was also for you to be able to explain to our viewers, what can they expect when their doctor or their psychiatrist, or sometimes even a family member say, I think you need admission.
Sure. Quite a bit. And I think hospitals do a lot to try and orientate patients well. Maybe if I can think about it, I can categorize it into 3 phases in terms of mental health care facilities. The first phase, I would say, is what we do and what we are able to offer to be able to orientate an individual. That process can start on the day that you arrive, or it can start before. A lot of places would have websites where you can have a look at the website, have a look at the facility. We try very much to present pictures of the facility so you can get a good feel of how open it is. A lot of hospitals are now being built in lush areas by the beach. Some of them are in places where there's animals, etc. And I think there's a significant shift in terms of facility, the mindset about facilities shifting, so that people can be able to see that mental health care settings are settings that we try as much as possible to make them comfortable and to make them home. So the first phase for me would be, how do we help the individual to acclimatize to the environment? We also, in my setting, have a helpline where you can phone and actually ask about the facility. We give you whatever material you want, especially, for instance, a loved one or a parent. You want to read up about the facility, the policies, the rules. You want to get a sense of, when my child goes into the facility, what can I expect? Because I don't know. And that's a very reasonable thing. Sometimes your first encounter when you go for admission is that one incident. A lot of our admissions take a couple of hours, to be honest. Because it's not just about signing the consent, but it's also about showing you around the facility. So we structure that routinely for patients. So you will have somebody who, after you've signed in the consent, etc., will then take you around the facility, show you your room, show you around the hospital, so that you have a good sense of orientation about the area. Then, depending on whether you're admitted early in the morning or late in the afternoon, a lot of facilities would also have somebody who actually orientates you to what happens here. So that's the first phase. It's around orientation of your surroundings, orientations in terms of expectation. You see people around, and trust me, there are no straitjackets.
Yes.
I've never seen a patient in a straitjacket.
I've never seen a straitjacket, even at the public hospital. Like I've worked at Sterkfontein and
I've never seen a patient in a straitjacket. So such things don't exist, guys, anymore.
Please.
So that's the first part really about what you can expect is the orientation. The second part is the stay in the hospital.
Yeah.
And while you are in the facility, for the duration of time that you're there, mental health care facilities, we try as much as possible to create order, to create routine, and to create a sense of self-reliance and independence. Because a lot of patients come through, they've got over-reliance on an individual. Excuse me, they sometimes need boundaries, and so you try to teach boundaries, etc. So the second part or the second phase of the stay really has to be about routine. Patients wake up fairly early in the morning, they need to get ready. You can't be walking around in your pajamas in a facility. So we try to create routine and order. There's breakfast at a particular time, it starts at this time, it ends at this time, so that we encourage people to get up from bed. Sometimes people come in, I'm deeply depressed, I don't want to get out of bed. So trying to create that sense of order with everybody else is absolutely important. You go to groups. You've got at least 3-4 groups at a time in a day. In between seeing your individual therapist, in between seeing your psychiatrist as well. And there's also some time to yourself. And some of these groups are also about artistic related things. Some of them are about journaling, and a lot of them are about tools. A mental health care facility, the sole purpose exists not just to give medication, but to empower individuals with tools of how do I deal with this diagnosis that I have. Either I'm there to find out a diagnosis and how do I deal with it, because our role is to equip individuals and their loved ones in terms of the family of tools to use given what I now know about myself. And that is the second phase. That's what happens in a mental health care facility. It's a fairly long day. Then you've got some time for TV or interaction or whatever the case may be. There are meals, there are structured meals at a particular time. And then there's also then time to go to bed. So we try and structure the day in that manner. And then the last phase for me is around how do we get you ready to go home and to integrate into the community, into your home. Sometimes by the time some patients come and get admitted, they've some relationships have gone wrong, and so we try and facilitate that process with family members. Or if there's a work employer relationship that needs to be mended, where there has to be some type of engagement, we do that. And so that process starts before discharge. So we do discharge planning as part of the in-hospital stay. So you might have family that needs to come in for a session, or a loved one that needs to come in for a session, so that we can be able to try and prepare for the time that you go back into your environment. And that's where you actually need to be using those tools. So those are the 3 things that I would say happen in a mental health care facility.
Wow. Well explained. Thank you so much for that. And the other extreme is that people think that people are going on a holiday. So I would have managers rolling their eyes when you write a letter to say, your employee or your loved one, your spouse is being admitted, and they just think that they're going on a holiday. We were speaking offset that most of the time I don't even see flowers and get well soon in a mental health facility more than I would see in a general hospital, and I wanted to just pick your brain on that. Why do people don't see mental illness as a disease, as an illness that sometimes, requires inpatient treatment?
I think there are a lot of reasons for that. I think some of them are historical. Historically, mental health has always been shunned. It has always been hidden. And hence even this podcast to try and get rid of stigma. And that stigma comes about as a result of negative sentiments. So historically, that still exists to some degree. And I think also because people hide it, we haven't been, things that you hide, you can never advance them because they are hidden.
Yes.
So the more we bring out things, the more we are able to interrogate them, the more we are able to normalize them, the more we are able to come up with ways of being able to deal with them. And so I think it's a transition that we're still going through.
Yes.
The degree to which we accepted mental health 10 years ago differs to how we see it now. And it's like a pendulum. Sometimes it gets a little too much
in
terms of how we relate to mental health. But I think the process is necessary.
Yes.
And so that's the second thing. And I think another reason why we, in general, mental health is not taken seriously is because for many people, you can't see it.
Yes.
Unless I am significantly psychotic individual who clearly cannot control how they think, how they act, etc. For majority of individuals, and by the way, those are very few who end up becoming sick to that degree. The majority of individuals, I can't see it.
Yes.
I can't touch it. I can't pinpoint it. I can't understand it. And because I don't, I reduce it. That's number one. Number two, I may not have an experience with it and I don't know how to deal with it. And because I don't know how to deal with it, I then dismiss it. So I think there are multiple reasons why people see it that way.
Yeah. And it's something that we should work on in changing our point of view. So how have things been? How is mental health in private sector looking? Are we seeing an influx of patients? Are people more able to seek help and access help, please?
I think there's definitely an influx. But I also want to perhaps paint a picture of what the spectrum is of mental health. You don't start off being very sick, which is the extreme. You generally tend to start off, I'm not feeling well. I don't want to get out of bed. I'm unhappy. And very often we compensate. I hide it, I try and do things, I want to go on holiday. There's a lot that we try and do. And by the way, this can take years. So it starts off slow. I need to be more resilient, whatever the case may be. And then you start getting to a point where it now begins to impact my work. When it impacts my work, either I don't go to work or I'm not proactive when I'm at work, I'm distracted, I'm aggressive or whatever the case may be. So this is where it starts to become a disorder. And very often this is when people seek help because either the family puts you under pressure or you are being given ultimatums. I'm losing my job, I'm losing my spouse. And so when it begins to interfere with life, very often this is when people sit up and take notice. And very often a lot of time has elapsed, So the increase in mental health care seeking individuals, we tend to see it here, but it's actually been going on for a while. So we're talking now in 2025, since 2020, perhaps that was quite a significant era there about mental health care related issues increasing, but a lot of people are still sitting here. And so we are beginning to see them. I come from a hospital setting. And so these are the individuals who are sick, and a fair number of them have already been unwell. And so when there is a trigger, when there is an insult, it actually pushes them over the edge. And so we are certainly seeing more people seeking help. And the environment, I think, also influences the degree to which people seek help. Whether I can afford it, whether I know where to go. But we are definitely seeing more patients. I mean, if I can tell you, you probably would know, the average waiting time for a psychiatrist appointment is a month. It is at least a month. So you can imagine by the time I want a psychiatrist, how sick I am. Now I must wait a month.
I'm desperate.
What happens to me in that month? Average waiting time to see a psychologist is a week to 2 weeks. What happens to me in that time? Because by the time I reach out, because of all of these environmental related issues, I am very desperate in that moment. And so we have challenges in the sense of waiting times for patients.
Yes.
We have challenges in the terms in the sense of beds available for patients. But what is fascinating for me is that we are seeing this shift in some areas and not so much in others. I don't know if maybe individuals are seeking help and they are being treated out of hospital, because you must appreciate that we tend to see the ones that are coming to hospital, but there are a lot that are being seen by GPs, a lot that are being seen by psychologists and psychiatrists, and a fair number of people, because of the era in which we live, they are comfortable to be treated out of hospital. I don't want to go to hospital. Whatever notions or reasons they have, I don't want to go. And so a lot of clinicians, and by clinicians I'm talking about nurses, psychiatrists, doctors, psychologists, etc., a lot of them are doing their best to try and manage, because you have to have a patient buy-in. If I have to admit you have to be agreeing that, doc, I can see I need this. And if a patient is adamant, I don't want this, so a mom is saying, my son is not going there, you have to work with them. Get their buy-in and show them, but can you see we are not winning here? And so there's a lot of navigation of all of those things that we're seeing, but there's certainly an increase in the number of patients seeking help. And by the time they come to us, they are significantly sicker.
Great. And why do you think there is an increase in number of people seeking help? I understand that people wait until it's too late for them to seek help, but are we becoming a weaker generation, or is there more awareness around mental health and mental well-being?
I think there is. I think there's been a shift in our attitude and our appreciation of mental health. I mean, I like to compare it a little bit to cancer. In that many years ago, very little was known about cancer. It was this feared diagnosis. And we only had so many people would get diagnosed fairly late in their illness. They would get treatment and many of them would not make it. But over time, because of awareness, people are talking about it. People are now becoming aware. I mean, in a wellness-related space, you would even have, I remember I used to write articles that say, by the time you are 21 or you are sexually active, you need to be having a pap smear. By the time you are 30, you need to be doing these screenings. By the time you are 40, there is a regimented way in which we approach screening. We know that stomach cancers and colon cancers are common at this age. And so, so there is some system that is being created around creating a sense of wellness, not just from a healthcare space, but also from an individualistic perspective. So I think that, and the more there is that type of awareness, the more people know about it. I now know that I need to schedule it. Medical aids are actually making it cheaper for me to access it. And so the system works collaboratively to actually navigate itself towards more people finding out earlier. And so because that is the case, more people are being diagnosed, more instruments and techniques are being developed to try and create that level of diagnosis. I think we are moving in the same direction in mental health. I think the more we talk about it, the more such platforms exist, the more people, and sometimes people will go to the extreme, and that's the pendulum that I was talking about, but we talk about it a whole lot more. We now seek help a bit more. And I think also from our perspective as the healthcare providers, we are more receptive. We are more accommodating. In the past, you would tell a patient, you must get admitted and that's it. Now I work with them. Now I want to engage with them a bit more wider. So I think there is some transition in the era in which you live in to try and be a bit more knowledgeable, accepting, etc., from a funding perspective, from different options that are being given to patients as well. And because of that, there's more receptivity. And as a result of that, we are coming to see a bit more patients seeking help than before.
And it's a good thing. It's not necessarily a worrisome thing for us when people actually seek help, because people will be like, well, if people are getting more sick, then I should be scared. Actually, no, it's good for you to be seeking help. But I think it's important that you seek help sooner than later. Right? And so we spoke about the fact that sometimes we have to engage with families and even parents to sort of like explain to them what to expect when their loved one is being admitted in hospital, and that we do need their buy-in. But in mental health, and in South Africa, we have a Mental Health Care Act that also allows us. I know that your hospital is more focused on voluntary admission, but there is an involuntary side of things. And I just want my audience to understand, when do you actually refer to when do you actually refer somebody for involuntary care, if you have any knowledge on that, please?
So patients, an involuntary patient, by the way, is an individual who is deemed not able to make informed decisions about themselves or their environment. They are sick to the degree that their ability to make decisions, unfortunately, needs to be taken, and people need to make decisions for their interest, because they're either harming themselves, they are harming others, or the environment, and so someone has to take over decision making on their behalf. And I think in South Africa we've got a very good structure in terms of being able to protect such individuals, because those are very vulnerable individuals where decisions are being taken on your behalf. So that's a fairly sick individual. So in our setting, where we generally tend to admit mostly voluntary patients, we do have an involuntary facility, but for a person to be deemed involuntary, they present to us, firstly, very often they come in fine. And you admit such a patient in a voluntary setting, and the patient deteriorates while they are in care. And you begin to see that even though we've started treatment, we are not winning. This person is getting worse. So that's one setting, that under monitoring and supervision, it becomes clearer to us that this person is not suitable for this environment in which we are currently treating them. A different scenario is when the individual already presents ill, and very often it will come through as a phone call. My uncle is walking around naked in the street, or they are wearing a helmet, or my CEO is not coming out of his office, he's under his desk, he's terrified, whatever the case may be. So sometimes it comes through as a panic call. Can you help us? So either you see them, or they come through already being in a state where they already need that type of involuntary classification. So patients like that, we generally tend to then go through a process. There is a structured process that needs to be agreed by more than one doctor. So 2 doctors must evaluate the individual, agree that this individual requires a different level of care. And so once they have that agreement, we then have even a phasic process. Let's give you 3 days. In that 3 days, we give you a significant amount of attention in a setting that is conducive for you to be treated outside of mingling with other individuals, because you're a risk. And then they're evaluated after that process. So there's quite a lot of structure and process that goes into certifying an individual as being involuntary. And while they are in that involuntary setting, we look after them one-on-one. Lots of attention. There is a time frame by which you evaluate, has this person gone through this phase? Are they now ready to reintegrate or not? Before they can then be taken back into a setting where they can be treated with others.
Great. And so you're referring to Mental Health Care Act, and I would advise it's public information. So please, to our viewers, go read the Mental Health Care Act of South Africa, so that you can familiarize yourself, whether for now or the future, or just to know how the system works in general. So one of the things also that you mentioned was the fact that the influx is also encouraged by the fact that the medical aid and the private funders are funding, private mental health care when it requires inpatient care. So can we talk about that? Like what options are available for our viewers who need admission, or who has been recommended to be admitted, so that they know how to access the help, knowing that the medical aid is covering for it without compromising their other benefits as well?
So we've got 2 types of patients in the private healthcare setting. Those who pay out of their own pocket, whether they have medical aid or not. Sometimes medical aid funds are exhausted. So despite having medical aid, some patients present as private. We call them private patients. They're paying out of their pocket. And then the other group which you are referring to are those whose benefits, are still available to them. So in the private healthcare setting, in the South African context, which is fairly unique, funding for mental health is it's guided by a certain amount of benefits that are being available.
Yeah.
These benefits are intended to cover consultations if you are not in a hospital, and there's a number of consultations that you can have, whether it's with a therapist or it's with a specialist doctor for mental health, or those same benefits can then be used in a hospital setting, which is fairly unique.
Yes.
I want to highlight that because you don't get that in other diagnoses. For instance, if you've got a heart disease or a brain injury or whatever the case may be. So there is a structure to which mental health care benefits are organized.
Yeah.
In a funded patient who has medical aid, the most important first step would always be to understand from your scheme how much benefits do you have. By the time patients come to us in a hospital setting, they have already used up some benefits.
Yeah.
Because you very seldom start off needing a hospital.
In hospital,
you very often feel, I'm not well. You make an appointment, you see a GP. The GP then refers you to a psychologist or a psychiatrist. And then, so those benefits get used up in the out-of-hospital setting. And by the time you then need to be admitted, the first step, most important step would be to understand with your funder what is available to you. The second thing I think would be conversations with your treating team.
Yes.
In a hospital setting for us, it is always a team. You never get treated by one individual. It is the ability to say, this is what we have available. How are we going to make use of the resources available to us to be able to optimize you here? And then how do we then have something left to be able to see you beyond this? Because once you leave the hospital, that is not the last that you need to be seeing of your treating team. So how do we make use of the little that we have and make it stretch as far as we can? It is a very challenging thing in our setting. A very challenging thing. But I would say that in short, the biggest, most important step will be consultation with your funder around what is available to you.
Yeah. And we are engaging with the funders to try and review, to make sure that patients have, they will always say that you have unlimited hospital cover, but when it comes to mental health, it's very limited. So we are engaging with them to try and see what we can do to make sure that those who need more than their their set days, are able to get help. So another thing that I would like for us to touch on this interview is the fact that I feel most people think mental health care is an expensive exercise. And when I'm a person and I'm a patient, I have a gynecologist, I have a cardiologist, and the amount of money that I pay to see my private doctors is equivalent to what somebody would pay to see a psychiatrist. So why do you think people view mental health service as such an expensive and sort of like an American dream? Like it's only for the rich and those who have a lot of money, the people who are in the community, in the township, in the rural area, this is not for them. And I think that is not true. So can we address the attitude? I think it's a conception or the misconceptions that people have towards the importance of mental health services. And
the fees that are allocated.
Yes, yeah.
I think perhaps the first thing that comes to mind for me would be that mental health very seldom gets treated by one professional.
Yes.
In other settings, I can get away with being seen by one clinician, whether it's a GP only or a specialist only. In mental health, especially if you are requiring specialist care, it is highly unlikely that you would be treated by one individual. In fact, it is not recommended because we all play a different role. Psychologist plays a different role to a psychiatrist. And so it doesn't get treated by one individual, which means that the fees would generally not be similar to what you would pay just a gynae, for instance.
Yeah.
The second thing I think has to do with mindset.
Yes.
I'm thinking that when I have an appendicitis, oh, trust me.
Yes.
I want to go there now.
Yeah. It's so.
I want to go there now.
I don't care how much it costs.
Exactly.
Yeah.
And so mental health care, as I mentioned, starts off very slowly. Over time, it gets worse. We compensate, we make do. And so because I've been juggling this thing for so long with my limited tools and my lack of knowledge, I think I can still buy more time.
Yeah.
And so when I finally come to you after being convinced that I need to come to you, and then you give me this price, and then I think, no, I don't have to.
I'd rather go to Dubai.
Right? So I think that there is this compensation for so long. I must be more resilient. So we try and negotiate.
Yes.
And because we think we can negotiate longer, the cost does not equate to what I think I need until I really need it.
Yeah.
So I think that's the second thing. It's just the mindset around the fact that very often it is not seen as urgent.
Yes.
I think those are the main reasons why people tend to think that mental health care services are more expensive. They really aren't.
They're not.
They are comparable.
Yes.
They are comparable to other specialities.
All right, guys, it didn't come from a shrink, So thank you. Thank you for that. So as well, you mentioned that when a person comes into hospital, they have to see a psychiatrist, a psychologist. What other members of the multidisciplinary team will people encounter in hospital? And can we also touch on the issue of addiction? Can people get help for substance abuse or substance addiction?
Okay. So naturally, there's many diagnoses in mental health.
Yes.
Depending on what your diagnosis and your need are. Maybe let's start with the addiction individual. Generally, in a mental health care facility, you will be seen by a psychiatrist.
Mm-hmm.
And their role looks at the medication that you're taking and how you are responding to it and many other facets of your care. The second individual that you certainly will be seeing will be a psychologist. And a psychologist helps you. And I mentioned that in a hospital setting, the role is to give you tools.
Yes.
And a psychologist is highly trained to be able to help you think through things.
Yeah.
To help you uncover blinders about how you see yourself, how you see your world, etc. So they help you open yourself up to what are the reasons why you are here, and they help you give you tools of how to navigate those things as an individual.
Yeah.
In a hospital setting, you will then also have groups, and those groups can be offered by occupational therapists or equivalents, and their role, there is a highly well-researched concept about us as individuals together being able to help each other through a process. And so I have an issue I'm dealing with. I come from a background where I have had certain challenges, same for you. And so how do we, when you listen to my story, can share your story and help me in listening to you find ways in which I can deal better with mine. And so there is a huge benefit to healing in community. With community, because that community, their stories help you gain perspective. And so you will certainly be part of groups, and those groups have got different goals. And so that is an additional resource that you will see. We also then encourage a lot of exercise. Mental health, you don't treat it with just medication and talk therapy and activities. You have to have a physical element to it. So there has to be fitness, there has to be good nutrition, there has to be me time, etc. We also include an element of art in it. So there is some art therapy that takes place there. A lot of people are able to express themselves that way. A lot of journaling. So you've got people who can teach you through the significance and importance of journaling. In an addiction setting, very often you sometimes need a social worker because by the time a lot of individuals with addiction come through to us, there is a damaged relationship back in the house. Sometimes the impact that I have had on my family needs to be navigated by somebody who can help us rebuild at home. And so a social worker does not only see you in the facility, they see you with your family, they also see you at home with your family. So in an addiction setting, there is also a social worker that can get involved where it's necessary. In our hospitals, we also have addiction counselors. And these individuals have had experience with some type of addiction in the past. They have overcome that addiction, and we find that they connect so much better with our addiction patients than we can. We have a lot of theoretical knowledge, a lot of mind-related tools, but they have a lot of lived experience. And there is something to be said about a lived experience that helps individuals to navigate, especially when it comes not just from somebody who's been through the experience, but who's also gone through some training to help them understand, what did you go through, what did you use, and how do you take that and give it to somebody else. And so those would be additional resources that they would encounter in our facilities. So it's a huge team that is actually helping you in the hospital.
Wow. That's so well said. Thank you so much. In closing, I would like us to talk about the fact that we're seeing also an influx in adolescent mental health. And I think since the pandemic, and I feel like it has always been there, but I think light has been shone on mental health. And so teenagers seem to be struggling more with mental health related issues. And so I know that we do have facilities that allow for adolescents as well to be admitted in inpatient care. So can you touch on that, on what parents can expect when their kids are admitted in hospital, which children require admission? Just to reassure them, because most of them, they think that we're going to over-medicate their kids and they're going to be zombies. And but some of the children are suffering so much that they need to be taken away from their environment to be able to receive extensive care.
I am a mom to a teenager. And I've often wondered, especially when I've been at our facilities and I've seen 12-year-olds, 13-year-olds, 14-year-olds, like I see my child in every single one of those. It is not easy.
It's not.
So I fully appreciate where parents come from when they refuse an admission. That's number one. Number two, for us as healthcare service providers, I think we also have thresholds. It is not so easy for me to recommend an admission for a child. When a child requires admission, there are quite a lot of balls that have been juggled to get to that point. Thirdly, I sometimes think that, especially when a child has a mental health illness, it takes a lot. The parents have generally been through a lot by the time they come to you. Because you think, this is my child. I need to be able to manage this child. And so we try and we try and we try. By the time we seek help, very often, Doc, I don't know what to do anymore. I am helpless. I am tired. I am frustrated. I don't know what to do. And so there are a lot of emotions that are attached to admissions of children. And so in all our facilities, managing children has got a different nuance to it compared to managing adults, because you appreciate the fact that you don't only have one patient. The mom is also my patient. And sometimes if the family is not together, it's the mom and maybe the stepdad or somebody else, and then there's another family, and then there's school, and so you have many patients that you are dealing with. And so admission of a child in and of itself is a very challenging thing. So given that context, or the fact that you're juggling with a lot of things, we try our best to actually try and make it as simple. And so for parents, I think I would say that engage with the facilities a lot. In our facilities, we even have sessions for parents while their child is in the hospital. After hours, you come through once a week. where we actually tell you this is what we do for kids when they're in the facility.
Right.
We take them through the program, we give them a sense of what the program delivers. We tell them why we have the rules that we have. A lot of the kids, I'm trying to navigate issues with my child. I end up not caring whether or not they smoke.
Yes.
And they come into the facility and the facility says there's no smoking.
Yeah.
There are rules. There is a logic to why these rules are being put in place. And so we end up fighting with parents. Kids are kids and they will try and break the rules, etc. So you tend to be a bit more stringent about certain things, and the kid complains to the parents and the parents think you are inhumane. It's a lot.
It's difficult. It is a lot.
Managing children is a really a speciality in psychiatry. And so we try and take parents through, this is the reason why we do what we do.
Great.
And so that's one. Number two is engagement with the facility.
Yes.
How can you make this journey as easy as possible for me in terms of giving me feedback, etc., etc. So there is a lot that I would encourage parents of children to actually do to try and get a certain level of comfort. But there's also a lot of room for us as facilities to be able to create space for the parents to understand and engage with us much better.
Wow. Thank you so much. This has been a beautiful interview. And I wish we could go on and on and on, because I've got a million questions to ask on behalf of my viewers, because I'm just trying to be a middleman and ask the questions that most people ask me. And I feel like sometimes I don't have all the answers for them. So it was great having you today on the show. And I would like you to just speak with our viewers and just, what would you say to somebody who has been recommended to consider inpatient care?
Sure. I think one is around perspective. That a facility brings together resources whose role it is to, in a very short space of time, be able to equip you as an individual. You are dealing with whatever the diagnosis may be, whatever the situation or challenge may be. And navigating things successfully requires time.
Yes.
It requires resources and knowledge. And that's what the intention of a hospital facility is supposed to be. But I also want to give perspective to the fact that all of us, we don't learn how to navigate through life by the time we are 21, guys.
Yes.
By the time we are deemed as adults, although we've been given a million lessons, we actually know nothing. But the time spent knocking those lessons into our heads by our parents proves itself when I'm then an adult. So sometimes the treatment that you get might seem like too much or whatever, but it is not, if I'm an alcoholic, it is not taking a drink after I've been in a hospital that's the issue.
Yes.
The issue is, do I understand why I did that? And those are the tools that we are being given in a facility, the ability to, on my own, be able to sit in the real world in which I exist, whether it's at work, at home, with my family, my kids, and understand why I feel the way I do. Do I know what I need to do when I feel this way? Do I know where do I go? Do I know when I need to reach out for help? I'm an asthmatic. And so I manage my asthma. There's a preventer and a reliever.
Yes.
I must take my preventer every day, but do I know when I must use my reliever? Because I understand that now this preventer man is not working as well as it should. And so there are triggers, there are points in the journey where I'm being taught you need to listen to your body. And when your body says this preventer is not working, you need a reliever, you identify those triggers and you reach out for that reliever. And so my message to the public would be, when it comes to mental health care facilities, see them as a facility that gives you the tools and teaches you how to use it. But the ability to navigate and use those tools successfully will come after the discharge, when you're navigating life at home.
Wow. Well, guys, I hope that you have learned. I do my best to try and bring you the best in the field to help you navigate just your normal daily life. So thank you so much for watching, and please don't forget to subscribe, to share, and to like. And also would like to hear from you, so please do comment and say how best we can help you, what kind of topics you would like for us to reach. So till we see you again, please remember to love your mind.
Yes.